This is Leslie. So when I met Leslie, he had a ton of pain, right? It was really, really bad. He was really frustrated. He had tried a bunch of things. It didn't work. So when I met him, what he had what was called a SI joint dysfunction and a sacral torsion and a sacral shear. Okay, so his tailbone was torsion and what's called a left-on-left sacral torsion. Okay, and then that was causing a sacral shear. Now, most of the time, sacral shears hurt with extension. Okay, it grabs your back and hurts with extension. But with him, it really didn't. It was more flexion. Okay, so the way that you fix a sacral torsion and therefore a sacral shear, because the shear is caused by the torsion, is that you realign, you strengthen the opposite piriformis and bring it back down, as well as stretch a few muscles. So what we're going to do here is rotate them back this way. All right. So Leslie, go ahead and stand up. Let's see how far you can move forward. Now go bend and tell me what point it starts to hurt. Right there. So when I met him, he was about right here, okay? And we've been at this a week or two, and he has pain at the base of his spine because it's shearing, okay? So now go ahead and have a seat right there. And let's just fire and strengthen the opposite, the piriformis of the side that comes out towards me, okay? And let's see if we can get more range of motion. Go ahead. So I had him do it 30 times, and he and I were doing this the other day, and he went from not being able to really bend at all, and then he was able to bend in a full forward flexion just by strengthening the piriformis. So he's re-rotating his tailbone and taking away the sacral shear at L5S1. So last time we had to do like 2 or 3 sets of this, of 30 reps. To fire that piriformis, and then he got it. So he and I are in our 2nd or 3rd week of rehab here, and now he's starting to have moments. I tell patients that have what he has that it takes 3 to 5 weeks, and it goes in and out of alignment, better, worse, better, worse, better, worse, better, worse, and then it stabilizes. But so now he's having those moments, he said, of times that he feels better. Okay, now stand up for me, please, and then go ahead and bend forward. So now he has more range of motion. Do you still feel that?
Oh no, I can go that far.
Oh, there we go.
I can go that far.
There you go. So now he has full flexion. So what I did there with him is this. So he was rotated this way, left on left sacral torsion. We fired the right piriformis, re-rotated him, and it took away the sacral shear at L5S1.